Hello, my name is Dr. David and I'm a general dentist in Mundelein, Illinois at Marquitz Dental. Today I'm going to break down a scene from the 1986 classic A Little Shop of Horrors, starring Steve Martin. And we're going to see what it looks like from a dentist perspective. There's probably some myths and probably some truths in the video, so let's take a look.
You have a talent for causing things.
Alright, let's pause right there. One, it is overly aggressive to walk into an office and just punch someone in the face. I don't think that's illegal, and I think that's a good way to have your assistants quit on you very quickly. So it's a little unrealistic there.
Be a dentist. People will pay you to be inhumane. Your temperament's wrong for the priesthood.
Let's pause right there. He just picked up an instrument. We do use that instrument today. It's called a forceps. We use those to take teeth out. So that is realistic. That's a real instrument used by real dentists and oral surgeons. All right, let's keep going.
Teeth would suit you still. So be a dentist. You'll be a success.
Alright, so I gotta pause there. There's a couple of things with that. One, I can't tell you how many patients I've had come in talking about how the dentist had a tooth pulled and the dentist had to put their knee on their chest to get the tooth taken out. So I've never done that, but I hear that has happened to some patients. Maybe they're getting it from this video, I don't know, but I have heard that. One thing I don't get is he was trying to take the tooth out and he was able to twist it in such a way where the instrument stayed in the mouth perfectly upright. Those instruments are pretty heavy, so I'm not sure exactly how he was able to accomplish that, but that's a little unrealistic and a pretty aggressive technique to try and take a tooth out. So he's getting his point across that he's good at inflicting pain. So good job, Steve Martin. All right, let's keep going.
Watch him suck up that gas. Oh my God! He is a dentist that he'll never ever be good.
Yeah, definitely illegal to kind of just take a puff of nitrous right before you start doing dental work. Wouldn't recommend that. If you ever see a dentist do that, I probably wouldn't stick around for whatever treatment is coming after. All right, let's keep going.
Who wants that teeth done by the Marquis de Sade?
Oh, that hurts. Wait, I'm not. No. Shut up. Open wide. Here I come. I am your dentist, and I enjoy the career that I picked.
This is a very unique perspective here, being inside the mouth looking out. I can't say I've ever had the privilege of having that perspective, so I imagine this is pretty accurate though. I mean, I see you have all the teeth that are there, kind of the right anatomy, the right shape of the teeth, so that looks pretty accurate. Yeah, I mean, it looks pretty loose the way he's holding that drill. Usually you like to have a finger rest. You like to rest one of your fingers on something else, another tooth that sturdies and make sure it doesn't slip or fall. So it looks like he'd be pretty prone to kind of slipping and cutting something there. But overall, kind of a cool perspective. All right.
And I get off on the pain I inflict. I thrill.
This poor assistant has now gotten hit twice in the matter of about a minute and a half, so I feel really bad for her. I hope she can find a job or maybe she doesn't have to take such physical abuse. Also, this song, I'm Your Dentist, is going to be stuck in my head for about 5 weeks. I can guarantee you that.
When I drill a bicuspid, it's swell, though they tell me I'm...
So he just used the word bicuspid. That is a correct word for a tooth. Usually you have your cuspid, which is what we call the canine. It's kind of the pointy one. The one right behind it, there's two of them. They actually have 2 points, so they have 2 cuspids or bicuspids. So we call them premolars more frequently, but bicuspid is a correct term for that. So good job, Steve.
And though it may cause my patience distress, somewhere, trouble above me. I know that my mom was proud of me. Oh, mama?
I'll pause there. I love my mom. I do not have a shrine for her in our office, unfortunately. So you can look all you want. I apologize, Mom. Maybe if we're able to kind of expand our office, we'll make room for a shrine to my mom. So there we go.
'Cause I'm a dentist and a six. Say ah. Ah. Say ah. Say ah. Now spit.
All right, so I'll pause there. We still use that today. The air water, sometimes we gotta rinse things out. You can squirt it pretty far, so that's pretty realistic the way he was able to do that. But kind of a funny way to do it. All right, pause. All right, well, thanks for tuning in. I hope you enjoyed my breakdown of the 1986 film Little Shop of Horrors. As you can see from that video, Steve Martin does not give dentists a good reputation there. We try our best at Markwoods Dental to not inflict pain. So even though in popular culture dentists have a really bad stigma around them, we're trying our best at Markwoods Dental to kind of curtail that stigma. We want you to feel comfortable at all of your appointments. If you have any questions, you want any other dentist videos you want me to break down, leave it in the comments, and we look forward to hearing from you soon. See you later.